Hello everyone, my name is Eugene Son, and today I will be presenting to you about the microorganism Trichomonas vaginalis. During this presentation, I will introduce you to what is Trichomonas vaginalis, the physical characteristics of the microorganism, the life cycle, its epidemiology, the symptoms one may have when affected with Trichomonas vaginalis, laboratory diagnosis of the microorganism, and how to treat, prevent, and control Trichomonas vaginalis. So what is Trichomonas vaginalis? It is an anaerobic, single-cell, flagellated protozoan. It is considered a parasitic microorganism in which it lives on and obtains its nutrients from another living organism, also known as the host. It is a mobile microorganism and uses flagella for movement. Trichomonas vaginalis only exists as a trophozoite. A trophozoite is a stage in a protozoan's life cycle in which it is absorbing nutrients from the host. It is found in the urethras and vaginas of women and the urethras and prostates of men. Trichomonas vaginalis is a common cause of urogenital infections and trichomoniasis. Now, I will list some of the physical characteristics of the microorganism. The size of T. vaginalis can range from anywhere between 7 to 23 micrometers long and 6 to 8 micrometers wide. It is oval in shape, and as mentioned before, it is a flagellated protozoan. 4 of the flagella are used for motility, but the purpose of the 5th flagella is unknown. The microorganism also has a barb-like axostyle that projects outward on the opposite side from the flagella. This axostyle may be used for attachment on host surface and may also cause tissue damage that is associated with trichomoniasis. Now that we know some of the physical characteristics of Trichomonas vaginalis, let us move on to the life cycle of the microorganism. As mentioned before, Trichomonas vaginalis exists only in the trophozoite form. As you can see from the diagram, when this trophozoite is found in the vagina or orifice of the urethra, it is considered to be in the infective stage. The parasite is transmitted from person to person, primarily through sexual intercourse. Trichomonas vaginalis is considered to be in the diagnostic stage when it is found in vaginal and prostatic secretions and the urine as well. The trophozoite multiplies by longitudinal binary fission. I will continue my presentation with the epidemiology of the parasite. Trichomonas vaginalis has worldwide distribution, with sexual intercourse being the primary mode of transmission of the parasite. The World Health Organization estimates that 180 million new cases of T. vaginalis occur worldwide each year, with 5 million of these new cases occurring in North America alone. Infants can get infected as well, but they get infected from passing through mother's infected birth canal. Prevalence of the disease in developed countries is reported to be 5 to 20% in women and 2 to 10% in men. From epidemiology, we will move on to the symptoms one may encounter if affected with the parasite. Those affected with Trichomonas vaginalis are usually asymptomatic, and men are primarily asymptomatic carriers of the parasite and serve as a reservoir for infections in women. However, Trichomonas vaginalis may cause trichomoniasis. Trichomoniasis is a sexually transmitted infection and is the common cause of vaginitis in women. Vaginitis is the extensive inflammation and erosion of the epithelial lining of the vagina and is associated with itching, burning, painful urination, and frothy whitish-yellow discharge. Although men are primarily asymptomatic carriers, they can occasionally experience urethritis, prostatitis, and other urinary tract problems. Let us now see how Trichomonas vaginalis is diagnosed in the laboratory. The method of choice to diagnose Trichomonas vaginalis is microscopic examination. It is easily distinguished under microscopic examination via a wet mount, in which the corkscrew motility of the microorganism is observed. Stained or unstained smears of the parasite can be examined as well. The diagnostic yield is improved by culturing the organism. Optimal growth for the parasite is in oxygen-free, low-acidity environments. Diagnostic yield can also be improved through monoclonal fluorescent antibody staining. A nucleic acid probe assay is commercially available and is another method of diagnosing the microorganism. Serologic tests, while not commonly used for diagnosis of the organism, is useful in surveillance of the epidemiology of Trichomonas vaginalis. We will conclude the presentation with the treatment, prevention, and control of Trichomonas vaginalis. Treatment of the parasite is done with the use of medication. Metronidazole is an antibiotic and is considered to be the drug of choice for treatment of Trichomonas vaginalis. Tinidazole is a more recently developed anti-parasitic drug and can also be used in treatment. In order to prevent becoming affected with Trichomonas vaginalis, people should have good personal hygiene, refrain from sharing toilet articles and clothing with those who are potentially affected with the parasite, and practice safe sex. The only method of controlling the microorganism is through eliminating the carriage of the parasite in men, because as mentioned before, men are asymptomatic carriers. These are the references I used for my presentation today, and with that concludes my presentation of Trichomonas vaginalis, and it has been a pleasure presenting this to everyone. I hope you have learned a lot about the microorganism, and thank you for watching.